The crisis surrounding housing affordability and health care are colliding as more and more Americans put off paying for medical care in order to pay their rent. This from a new report by Enterprise Community Partners, and joining us with more is Adriana Belmonte. This sounds shocking, but not saying yay or nay to Elizabeth Warren. She talked about this kind of stuff growing up, that her parents would choose, we're not going to do the medicine, we got to pay the mortgage or we got to pay the rent.
Yeah, the survey was among renters, and 54% said that they've delayed some kind of medical care in order to pay their rent. And the most frequent instances of, medical needs were preventative checkups, getting over-the-counter medicine, and then seeking treatment while you're sick. And it kind of raises a red flag here. There's the healthcare costs, and then there's also rent affordability. And just last week, I did something about how rent affordability is tied to minimum wage. So it really just shows how all these problems affecting, lower class Americans are so intrinsically tied together.
And so what sort of then ends up happening? Because there are bigger than healthcare costs that come as a result. I saw a story this morning about a young man who switched to a cheaper insulin when he was off of his parents' healthcare plan and ended up dying because his body did not react well to that insulin. So I assume somebody is now looking at what those larger healthcare costs are going to go up even more as a result of this, one would imagine.
Exactly, and it also kind of raises the question, where does this responsibility lie? Is it on housing and urban development for fixing the high rent? Is it on health and human services for trying to fix healthcare costs? And then there's also labor with the minimum wage as well, because that kind of plays a role in all of this. And I think it's a matter of everybody kind of trying to recognize their role in it and, stepping up to try to fix it, because it just can't be fixed in one area.
Housing costs kind of go up and down over time, and it also matters where you are. The healthcare problem is a chronic problem, and this is, so we're hearing a lot about this in the presidential election. What should we do about this? And part of the problem is people just don't have any coverage. They have the choice to buy into Obamacare, but it's there are subsidies for some low-income people, but not for everybody. So some people just look at the numbers and say, I can't afford this. I mean, so especially when you hear that people are not getting preventive care. I mean, that is like that should be if you have a decent health insurance, normally it does cover preventive care, most of the costs anyway. And that's the thing that strikes me as the biggest problem, is if you're not getting preventive care, that means you're just going to have other problems. That is just a giant hole in our healthcare system.
Well, and when we hear the president tweet that there's no inflation, and we hear market watchers say, oh, where's the inflation? Well, talk to people.
That's where it is.
They will tell you their healthcare costs are rising and housing.
Yeah, and also what I thought was interesting is one person I talked to, she had stressed the fact that, even for people who do have coverage, there's still high copays, high deductibles, and while it might be affordable for the average person, there's some people that those costs can really add up, and they're not willing to have to worry about covering those.
Adriana, is this survey all ages? It's not just young people?
No, it's all ages. I think span 18 and up, obviously. And then they also talked to medical professionals as well, and they all said that they've had at least some patients who've, expressed concern about having to pay their rent, so they might have decided, hey, I'm not going to do this thing that you're recommending because I need to pay rent.
Yep.
All right, thanks, Adriana. Appreciate it.